Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, April the 21st, 2021. Joining us today is Toronto Mayor John Tory, Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto's Medical Officer of Health, Dr. Eileen. Mayor Tory.
Well, good afternoon. The City continues to work with its healthcare partners, pharmacies, doctors and Toronto Public Health to administer all available COVID-19 vaccines with increasing efforts in COVID hotspots. In fact, as you will hear today, we continue within available supply limits to step up the pace and to innovate as we go about the largest vaccination effort in the history of the city. 948,657 COVID-19 vaccine doses have now been administered in the City of Toronto. And like everything else in this pandemic, we've made sure that the ongoing vaccination rollout is nimble and that it is ready to adapt based on the best public health advice available. That's why we are focused on getting the shots that we do have in the arms of residents in hotspot neighbourhoods, the places where our public health officials say these vaccines are most needed and can make the biggest difference. This has already led to thousands and thousands of doses being administered at mobile clinics in hotspot postal codes. I'm excited to announce today another important element of this campaign, the Team Toronto Sprint strategy. City officials and Toronto Public Health have worked with our hospital and healthcare partners to build this strategy, which will focus on ramping up vaccinations in the 13 hottest hotspot postal codes in the city over the next 2 weeks. This will bring vaccine doses for eligible people 18 and older to where people live in the neighbourhoods that are in the greatest need. And once those have been addressed, we will, of course, subject to vaccine supply, move on to the next group. Make no mistake, this is a team effort involving the city and public health, but also our hospital partners, our healthcare partners, and our community partners. This is where the groundwork that we have done to help mobilize and support grassroots organizations will lead to the greatest and best vaccine ground game in the history of our city. The first of these sprint strategy clinics in Etobicoke, North York, Scarborough, and Thorncliffe Park come together because our community partners go door to door encouraging people to get vaccinated. We bring the vaccines, we bring the vaccinators, and they bring the community to get vaccinated. This is Toronto in action. Every aspect of our city working to get people vaccinated, because we know from our public health experts that a vaccine dose in these hotspots will have a bigger impact on stopping the spread of COVID-19 and ultimately turning the tide of this pandemic, which we must do, as you will hear from the numbers that are going to be conveyed by Dr. Davila in her report today. But our sprint strategy doesn't stop there. Within the parameters of available supply, once again, we will also be increasing vaccination capacity across the network of city-operated clinics and substantially increasing capacity at the clinics in the hotspot areas. Effective May 10th, based on supply forecasts, we're increasing the number of doses administered per day across the network of 9 city-operated clinics to 8,586 doses per day, while providing at the same time thousands of doses to the mobile clinics. Based on anticipated supply, we will be opening up 231,000 new appointments at our 9 clinics between May the 10th and June the 6th. Our clinics at the Scarborough Town Centre, Malvern Community Centre, and the Hangar will all be increasing their capacity by 25%. The Carmine Stefano Community Centre in North York will have its capacity increased by 20%. And we're ready to increase capacity further when we have even more vaccine supply. We have the capacity to do more. We've had the capacity to do more for some time due to the work put in place by Chief Pegg and his team. And as supply increases, we have the ability to ramp up capacity. What is clear now is that we have a Team Toronto effort that can administer thousands of doses a day, that can adjust as needed to get the limited doses we have in the areas where they're most needed, and that our team has even more capacity at the ready to do more as soon as we get more vaccine. That's just one example of the amazing work Team Toronto is doing to get people vaccinated. But I want to talk about another innovative, made-in-Toronto idea that I'm proud to see us launch today. We've created expanded mobile teams. The City of Toronto, in collaboration with our Ontario Health Team partners and under the leadership of the Sunnybrook Centre for Pre-Hospital Medicine and Toronto Public Health, have been working behind the scenes to significantly expand our mobile vaccine team capabilities, and it really is a team effort. By leveraging the expertise of Toronto Paramedic Services and the Toronto Fire Services, we have assembled multidisciplinary teams who will be able to quickly deploy to locations around the city in order to operate mobile COVID-19 clinics as directed by Toronto Public Health. This is an innovative and responsive solution that has been made in Toronto, for Toronto, by Toronto. We are leveraging the clinical expertise of our Toronto paramedics and partner physicians and healthcare professionals, all of whom will serve as vaccine loaders and immunizers, while the Toronto firefighters will look after the logistics, the client screening registration, and the aftercare support. This program can ramp up further in response to vaccine availability and community need and will begin to operate as early as next week. It's being tested now. Toronto Public Health will deploy these teams to locations that have been identified by our Ontario Health Team partners in response to prioritized risk and vaccine availability. Our teams will be available, these teams, 7 days a week. This program responds directly to the needs of different groups for different solutions in order to serve different populations. These teams will form part of our enhanced supports for those, for example, experiencing homelessness, those in high-priority areas, including shelters, drop-in sites, health services, and encampments. The program is being finalized and tested and will start operations early next week, but I think you can tell from the description how able it will be, these teams will be, to be able to move around where they're most needed in a very easy and flexible manner. This is good teamwork done at wartime speed, and it will lead to more people, some of our most vulnerable residents, getting vaccinated. And I want to thank all those who've been involved at all different areas of staff, from the firefighters through the paramedics, the health partners, Toronto Public Health. Everybody that's been involved in this has done a splendid job at pulling this together and making it work, as I'm sure it will, following some very brief testing this week. On a slightly different subject, I am pleased to announce, and it's important we take the opportunity, especially now when people are looking for relief for themselves and for their children, to announce that registration will be opening for virtual spring recreation programs tomorrow, April 22nd. Following the success of the Spring Break Camp TO virtual workshops, we are pleased to be able to offer online programs to provide safe at-home activities for children, youth, and for older adults. The Spring Break Camp TO virtual workshops ran successfully last week with close to 1,200 registrations and positive feedback received from participants, families, and caregivers. I'm sure it provided a degree of relief to parents who had to help invent things to do for their kids within the range of the public health restrictions. Approximately 1,000 spaces will be available in this new offering, and programs will kick off during the week of May the 3rd. Free, adapted, and inclusive programs for participants with disabilities, including science, board games, chair yoga, bingo, cooking, and Zumba, will also be offered. So that is my update for today. Good news in our vaccination efforts, good news in terms of the innovation we're bringing about in the City of Toronto to get more needles into more arms, especially where it's needed the most, and good news for those looking for in-home recreation. But we also know that we are still very much in the third wave, and still extremely troubling numbers are upon us each and every day, as Dr. Davila will outline, when it comes to cases and when it comes to the increasing pressure on our healthcare system. I continue to work with the other governments to both help address ever-changing requirements and to try to ensure clarity, comfort, and support for the residents that we all serve. It continues to be crucial for all of us to keep following the basic public health advice that has been outstanding from the beginning. And we need to follow it right now as much as ever, and of course to get vaccinated as soon as people are eligible. I'd now like to invite Chief Pegg to give a further update on our vaccination efforts, followed by Dr. Davila's report on the current situation. Chief?
Thank you, Mayor Tory, and good afternoon. The network of 9 city-operated vaccine clinics continue to operate daily across Toronto with people receiving vaccine from 11 a.m. through 8 p.m., 7 days per week. All 9 clinics continue to operate efficiently and smoothly, with each clinic operating either at or very near maximum capacity on a daily basis based on vaccine availability. Wait times for those who arrive shortly before their scheduled appointment are very short, with most people not having to wait at all. In fact, the majority of people are checked in, vaccinated, and checked out of the clinic in about 30 minutes, including the 15-minute aftercare observation period after you're vaccinated. The number of appointments that are made available in city-operated vaccine clinics corresponds directly with the number of doses of vaccine that are available to be administered. At present, we are able to administer 56,322 doses of vaccine each week across the network of city-operated clinics. We are very pleased that the number of doses of COVID-19 vaccine that the City of Toronto receives each week from the Province of Ontario is expected to increase over the next few weeks. This allows us to achieve 2 key objectives: to increase the capacity of our network of city-operated vaccine clinics, and especially those serving priority neighborhoods, and to significantly enhance the allocation of vaccine to hospital and Ontario Health Team partners moving forward, thereby increasing opportunities for both mobile and pop-up clinics in our communities. As Mayor Tory advised, we will soon be opening the next block of appointment dates in city-operated vaccine clinics via the provincial booking system. This block of dates will begin on May 10th and run through June 6th, resulting in more than 231,000 additional individual appointments being made available for eligible residents to receive their vaccine. As of May 10th, we are expanding clinic operations in a number of clinics, including the Hangar, Scarborough Town Centre, Carmine Stefano, and the Malvern Community Centre. This expansion of clinic operations will make it possible for more than 60,000 people to be vaccinated against COVID-19 each week in the city-operated vaccine clinics alone. Many more will also be vaccinated in clinics operated by our hospital and Ontario Health Team partners as well. Eligible residents can book their vaccine appointment in city-operated clinics by accessing the online provincial booking system at toronto.ca/COVID-19 or via the provincial call centre at 1-888-999-6488. Mayor Tory announced that we are also significantly expanding our mobile clinic operations as a result of a Made in Toronto solution that builds on our previous success. From the outset of our COVID-19 clinic operations, beginning with the initial proof of concept clinic in January, our Toronto paramedics and Toronto firefighters have been directly engaged. Working under the direction of our Toronto Public Health Team and in collaboration with our Ontario Health Team and hospital partners, we have leveraged our first responders from the outset in order to maximize our ability to deliver vaccine across our city. I'm very pleased that we are, once again, significantly expanding our mobile vaccine deployment capabilities across Toronto. Under the leadership of Toronto Public Health and the Sunnybrook Centre for Pre-Hospital Medicine, and in collaboration with our Ontario Health Team partners, we are deploying additional paramedics and firefighters to support our mobile clinic efforts. This will further assist some of our most vulnerable residents, such as those experiencing homelessness, those who rely on our shelters, drop-in centres, and those who live outdoors. First responders, including both paramedics and firefighters, respond to people in their time of need, where they are, 24 hours per day and 7 days per week, and are ideally suited to support these expanded mobile clinic operations. Our Toronto paramedics, alongside physicians and other healthcare professionals, will manage the clinical roles, such as vaccine loading and the administering of vaccine. Our Toronto firefighters will manage mobile clinic logistics, screening, registration, and aftercare. From the outset, we have ensured that our plans and processes are both responsive and nimble. The expansion of these teams is another example of our ability to respond to the ever-changing nature of COVID-19 response and community need. I would like to extend my sincere appreciation and thanks to the entire team that has worked day and night to make this expansion of mobile operations a reality. I would also like to acknowledge and thank both CUPE Local 416 and the Toronto Professional Firefighters Association for their support and leadership in making this happen. Our Ontario Health Team partners, in collaboration with Toronto Public Health, will determine the locations that our expanded network of mobile teams will serve, along with the means by which each mobile clinic will be scheduled, booked, and communicated. This will ensure that we are best able to meet the unique needs and circumstances of each specific neighborhood and population that we serve. Each day, across Toronto, our hospital and Ontario Health Team partners are operating a number of pop-up clinics with great success. It is not uncommon to experience significant lineups in many of these pop-up clinic locations, nor is that necessarily a bad thing. This is the result of the fact that each pop-up clinic serves a unique and specific group of people in priority hotspot communities across Toronto, with each location determining the clinic operating model that best serves that particular location. While the city-operated vaccine clinics operate solely on the basis of pre-booked appointments and specifically assigned appointment times, pop-up clinics generally do not. For many of the communities that pop-up clinics aim to serve, our community partners and local host agencies explain that many clients are not able nor comfortable in accessing online or telephone-based booking systems. Accordingly, pop-up clinics tend to operate on an in-person drop-in basis as opposed to pre-booking appointments. Further, our community partners explain that for many, seeing familiar and trusted faces, either in line to receive vaccine or involved in clinic operations, builds both trust and confidence. I would like to thank and acknowledge the many vaccination partners and local community host agencies who are working together to vaccinate thousands of people each day. With more than 948,000 doses of COVID-19 vaccine administered in Toronto already, we have much to be thankful for and much to look forward to. Thank you for all that you do to help stop the spread of COVID-19 in our city. In closing, please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunization in Toronto. I will now ask Dr. Davila to bring her report.
Thank you, Chief, and good afternoon. I'll start by saying that today's numbers reflect the seriousness of the situation in which we find ourselves. Today, I'm reporting 1,302 cases of COVID-19. There are 1,010 people in hospital in Toronto. 194 of them are in the ICU. 128 of those people are intubated, which I mention today because the figures for people currently in hospital, people currently in ICU, and people currently intubated are all the highest recorded at any point in the pandemic so far. Finally, I'm reporting the loss of 27 more lives. In the week since last Wednesday's report, 93 lives have been lost to COVID-19. I'm not going to say a lot more today, except that as of today, the death toll for the whole of the pandemic in Toronto is now 2,970 people. If the loss of life continues as it has, we can expect to pass a death toll of 3,000 very soon. I ask everyone to ask themselves if we should mark this loss of life in some way more than as a milestone. And that is why I ask all of us to reflect on this terrible loss of life and on what we can do in the days and weeks ahead. COVID-19 spreads easily, in part to the extent that we make it easy. And we know how to make it difficult. Staying home, staying apart, keeping a careful distance outdoors when we're around people we don't live with, wearing a mask, getting vaccinated as soon as you can. If you're hesitant, please find a health expert you feel you can trust and talk through the reasons for your hesitancy. But anecdotally, my impression is that there are far more people in Toronto who are ready to be vaccinated than there are people with reluctance about the idea. And for that, I am grateful, because it's evident we must do everything we can right now to disrupt the spread of COVID-19. There are all clear steps. The ones I've outlined are all clear steps to protect yourself. They're effective steps, and they are steps that may save your life or someone else's. In your own life, I implore you to be as strict as you can be for the next few weeks at protecting yourself and those who matter to you. At the same time, public health and the healthcare system are working to help you protect yourselves. That is why I'm issuing a Section 22 order under the Health Protection and Promotion Act to allow Toronto public health inspectors the discretion to close workplaces where we have identified at least 5 cases of COVID-19 within a 14-day period that the evidence indicates are linked to transmission in the workplace. This is a decision we will take only to the extent the circumstances demand it, whereby requiring the closure, the spread of COVID-19 in a workplace can be interrupted for everyone's benefit. That is why the people in Toronto's hospitals who are working flat out to care for the 1,010 people who are sick in hospital now are also finding the capacity to work with local healthcare providers like Ontario Health Teams and community partners on the ground to deliver mobile and pop-up clinic vaccine access to neighborhoods at highest risk of COVID-19. By reaching them, all of Toronto is better protected. This is a time for everyone to commit to their part, wherever it may be. There are many times when we cannot avoid one another, and there are many times we can. In consideration of all those lost to COVID-19, I ask each of us, in all walks of life, to do everything in our power to prevent the spread of the virus. I'll now hand it over to Brad to moderate the question and answer session.
Thank you very much, Dr. Davila. Before we go to questions, just a reminder, reporters, to please unmute yourself before asking your question, and we'll go first to Austin Delaney from CTV News. Austin, go ahead, please.
Thanks very much. I think my question is for Matthew Pegg. It has to do with the number of people who are homebound, and there's between 5,000 and 7,000 that need shots at home. Paramedics are doing between 150, 175 a week. I was speaking to the daughter of an elderly man waiting for a shot today, and she says by her calculation, you'll be well into the fall before these people are vaccinated. You got a plan? Is there a concern? Thank you.
Sure. Good afternoon, Austin. So, without any doubt, the challenges faced by our homebound population are very real and something that are very important to all of us. And our homebound vaccination program is one that has been underway for some time. It is a program that is coordinated through the local health integration networks, and each of the LHINs receive the request for homebound services. They are assembled and compiled onto registration lists Those registration lists are ultimately provided to the City of Toronto via Toronto Paramedic Services, and from there, they are prioritized, they are identified by priority neighborhood, and they are sorted by group, sorted by geography. The reason they're sorted by geography is in order to deploy mobile, to mobile service and to service homebound clients, there are physical and just factual restrictions that exist with respect to vaccine that Dr. Davila is better to speak to than I. But I have learned from her and our Toronto Public Health colleagues that once a vial of vaccine is punctured and vaccine is drawn into a syringe and administered, there is a very defined period of time for which that vaccine remains viable and can be administered. And if that time expires or we move past that time, that vaccine is then wasted. So the team groups them. We try and do it on a prioritized geographic basis. I can tell you that there are a considerable number of people on that list, but I can also tell you that we are vaccinating a considerable number of people. And Austin, I'll end by saying this. The news that was announced today with respect to the increasing provision for mobile clinic response and the increased engagement on the part of Toronto paramedics and Toronto firefighters alongside our partners in Toronto Public Health and Ontario Health teams ultimately give us the ability to be increasingly nimble and give us the ability to deploy to more places at more times and in essence to do more. So I am really looking forward to seeing this program come to fruition. I'm excited to see next week happen and to get very quickly to the point where we can launch additional mobile clinics in response to those prioritized needs. I'm not sure if Dr. Davila has anything you wish to add to that.
No, I think the Chief has answered the question, and covered the major aspects. Clearly, we are interested in making sure that those that are truly homebound are provided the service within their homes. There are some for whom movement or getting out and about to medical appointments is a little more challenging but doable, and there are a number of services and supports to help people access vaccine out of their home if that is indeed their condition. But as you've heard the Chief say, there are a number of resources being directed towards ensuring that those who really do not go out of their home at all for any kind of medical appointment are afforded the opportunity to get vaccine within their home with the resources that are being deployed.
As a follow-up, if I can ask Doctor and also Mr. Mayor, are you satisfied that it could be the fall before these very vulnerable are actually immunized?
So Austin, I'll start off and then perhaps let the Mayor chime in. At this point in time, I think our challenge is largely around vaccine supply. We're hoping that that should be resolved in a few short weeks if the predictions that we've been provided are indeed accurate. I think as we're able to get through, vaccine or get greater vaccine supply and vaccinate a greater proportion of our population, particularly through larger clinics like the ones that the city operates, that frees up some of our mobile capacity in a greater way so that we can get to those who are truly homebound and would have extreme challenge, if not outright impossibility, to get to clinics outside. As we're able to redeploy resources, we should be able to get there faster. I think it's the intent of all vaccine partners to ensure that all those who are interested in receiving vaccine get that vaccine as soon as possible, when they are eligible and as supply allows.
I will only add to that I don't think any of us involved, and there are many people involved in making these arrangements and making these decisions, are satisfied or would be satisfied until we had enough vaccine that we could get this all done, tomorrow morning if we possibly could. And we have dramatically increased available capacity, but we don't have the supply. And so it does lead to situations like the ones that we've seen on television where we simply have to set a list in which, in order of these vaccines being administered, and take account of some of the very practical realities of the fact that, for example, each of the calls to homebound people takes a lot longer because you're dealing with only one person, and a full crew of people, as it were, have to go and deal with that. And that's not a complaint, it's just a statement of fact. And so as the supply increases, those challenges will still be there, but we will have much more in the way of supply to have some of these innovative kinds of solutions we've brought to the table today put in use to look after all of the people who are waiting. The hardest part of these jobs, I think, so far, and there's been a lot of hard parts and a lot of misery and a lot of tragedy, has been in the fact that there are a lot of groups out there who are very deserving and very anxious to get the vaccine for a whole lot of reasons we all understand, but it is not possible, given the supply we have, to do everybody at once. And so we've had to sort of set up some kind of a system that sometimes seems like it's unfair to some people, but no matter how you chose to do it, somebody is going to be dealt with later than somebody else. And our objective is to get it done as quickly as possible for as many people as possible. And as soon as the supply permits that, we have the capacity to ramp up.
Thank you. We'll go next to David Ryder from the Toronto Star. Dave, go ahead.
Hi there. Question, I think, is for Dr. Davila and Mayor Tory, if he wants to add anything, which is the Ford government appears to be doing something around paid sick days, something both of you have called for a long time. There's questions as to, obviously, the details, especially how long such a program would last. It could range anywhere from the length of the pandemic or even beyond, but it could be as short as just this current emergency order. So Dr. Davila, to make a difference in alleviating suffering in Toronto and to bringing this pandemic to an end as quickly as possible, how long does this paid sick day program need to be? And what are the main things you think it needs to include?
So, David, thanks for that question. You know, without trying to predict the future, I know we've heard people talk about the potential for a fourth wave. And of course, that's a prospect that none of us really want to contemplate ever, much less at this time while we're in the midst of dealing with a very significant third wave. But I would say this, I do think that, I'm optimistic, I'm hopeful about the prospects of paid sick leave, and I do think it is an important aspect of actually helping people to do the right thing, to stay home when they're ill. Certainly it should be of long enough duration that it is able to have the desired impact, which is effectively to reduce transmission of COVID-19 and to afford people the ability to actually stay home safely without having to worry about, meeting their needs, feeding their families, paying their rent. These are the concerns that they shouldn't be thinking about. They should be thinking about staying home, reducing the likelihood of transmission of COVID-19 so that we can together get past this wave and hopefully really get to the other side of this pandemic. So I'll turn it over to the Mayor, see if he has anything further to add.
As someone who has been a longstanding and outspoken supporter of the need for these kinds of programs to be enhanced to the point where they provide the kind of protection that will ensure the lack of spread of COVID-19 and the elimination of people who go to work sick because they're afraid of losing their paycheck. I think that the real shortcomings of the current availability of a program from the federal government are that it's not fast enough in getting money into people's hands so that they can provide for their families from the first minute that they have a symptom or are tested positive. And secondly, it's not enough money to allow them to provide for their families. So to me, those are the two most important things that should remain in place through until the pandemic is declared over by the health officials. And I don't think any of us know exactly when that's going to be, but it certainly should be for that period. And then if there's to be a debate about whether this should become a permanent feature of the law or of a business or government practice, that can happen later. And frankly, to me, how long it took to get here or how we got here, these are valid debating points, but the important thing is that the right thing is going to be done now, it would appear, and that it should make sure we get the money to people quickly, that it is enough money to allow them to provide for their families adequately in terms of basics, food on the table and paying the rent, and that it should last during the period of the pandemic.
Thank you. My follow-up question, I think, is for probably Dr. Davila, but anybody who feels they can answer. And just that with the increased expected vaccine supply, I don't know if Chief Pegg has any numbers to go along with that, but with the increased supply, is there any chance that the minimum age for the city clinics will be reduced from 60 anytime soon? We saw it come down very quickly from the higher age brackets. But I notice now we're staying at 60, and then obviously there's the addition of the mobile and pop-up clinics. Is that on the horizon?
So, David, as you know, the clinics that are run by the city are managed through the booking system that is run by the province. So the province actually controls the criteria that allow for eligibility within the city-run clinics. And I can tell you that we're in constant conversation with them, and they are actively discussing with all of us throughout the province around how to adjust and when to adjust eligibility criteria, particularly in light of the fact that we're anticipating a greater vaccine supply, hopefully within the next couple of weeks.
Okay, thank you. We'll go next to Mark Douglas from 680 News. Go ahead, Mark.
Thank you, Brad. Dr. Davila, the 13 hottest hotspots being identified in this sprinting program, what's the criteria public health is using to determine which areas in the city actually have the most urgent need?
So the 13 forward sortation areas or postal code areas, they're in the city, and a part of that focused strategy that we're undertaking with our healthcare partners were landed upon by Toronto Public Health in concert with our healthcare partners and premised on data relating to COVID-19 risk and as well vaccination rates and certain other socioeconomic characteristics. So they're all data-driven decisions that were made by Toronto Public Health in concert with our healthcare partners, thinking about how best to use a limited supply of vaccine to deliver the best result.
Thank you. And then the follow-up question to you as well, Dr. Davila. You mentioned the city's closing in on 3,000 deaths. We spoke earlier this week about how the city is also closing in, however, on 1 million vaccinations. Is the effort to stop the pandemic winning in that race?
Well, you know, Mark, I would say this. What we need is a combination of things. There's no question vaccine is an important component of our response at this point in the pandemic. But you might have heard me say before that vaccine won't get us out of this current wave. It will help us, absolutely. It provides an important protective benefit and is really about preventing future waves of COVID-19. That's the most important part, the most important role, I should say, that vaccination efforts play right now. When we're talking about doing what we can to reduce transmission right now, it is all about the measures to reduce transmission. And you've heard me talk about this. This is about staying home, staying apart, being very conscious about maintaining distance when you're outside, especially when you're with people with whom you don't live, or when you encounter people with whom you don't live, wearing your mask, and all the things that we can do as government in order to help support people in staying apart and in doing the right things, like staying home when you're sick. The combined public health measures along with vaccine, that's actually what we need to win this particular fight, if you will, against COVID-19.
You know, Mark, I was just thinking about it kind of like you'd think about a hockey game. I mean, in a hockey game, it's the players on the ice that are actually scoring the goals, so they're administering the vaccinations, or they're, trying to put measures in place, providing health care and so on. But sometimes in a close game, you want to bring the crowd into it. And we got to bring the crowd into it. And it's the 3 million people that have to decide that this is really the time. And I think people are doing quite well at this, but I think we have to do even better at getting the crowd into this in the, kind of the third period, because we're in the third wave, and keep the vaccinations going, keep playing a good game on the ice, but then make sure the crowd is into it to provide support for the vaccination effort to get us all the way there. We've just got to have a more intense effort. We lost, you heard Dr. Davila say, we lost 93 people in the last week in the city of Toronto. That's more than the number of homicides we had in the city the entirety of last year. And I think that people, sometimes now maybe they've become numb to these numbers, but these are people's mothers and fathers and grandfathers and brothers and sisters, and they ranged in age, I think, from the mid-50s to the 90s, and some of them maybe a bit younger than that, but many of them in that age group. So it's just the same rules that have been in place for a long time now, plus the vaccination effort, but it's the crowd that has to get into the game to make sure that we're providing maximum support to all the people who are vaccinating and who are providing health care.
Thank you. We'll go to our final question, and it's from Jane Stevenson at the Toronto Sun. Go ahead, Jane.
Oh, thanks. I just wanted to follow up a little bit on what Mark asked about the millionth vaccine. I guess we're getting very close to that number. And if the mayor and Dr. Davila could talk about putting that number into context in terms of how far we've come and how far we still have to go. It seems like a significant number.
Well, yeah, I might not, give you the answer that you're looking for in terms of, I mean, we have come a long way. I mean, I remember we had these meetings back in the fall before there even was a vaccine, starting to plan these clinics, and the notion that they're open, the 9 that we operate, that we've expanded beyond that with the efforts of our hospital partners. We have now these huge and somewhat innovative efforts to vaccinate people through the use of the firefighters and the paramedics and the community organizations. So we've come a long way to the point where there will be 1 million doses. But I think we shouldn't, get carried away with that. It's a milestone, but we still have millions more to do in terms of people's second shots and in terms of the remaining people that need to get a first shot. And so, I mean, to me, when you pass over 1 million or 1.5 million or 2 million, it's cause for a degree of satisfaction that things are working, that were put in place. We still have a supply issue, which looks like it might be improving in the next period of time, but we will have no celebrations around here. I mean, we will commend people for the work well done, including the planning work done by Chief Pegg and Dr. Davila and the whole team, and all those that are out there actually doing the needles into the arms, and all the people who have signed up. We've got a lot more people that have to sign up, and a lot more vaccination to be given, and a lot more supply that we need. So I don't think we'll be having any parties when we pass over the 1 million mark, because it's just one small step on the way to a goal that still is somewhat off in the distance.
Yeah,
And Dr.
simply, I would concur with the mayor that it's certainly worth marking the accomplishment that so many have worked so hard to achieve over the past several weeks. But frankly, I don't think any of us will be satisfied until we know that every single person who wants a vaccine and is eligible for a vaccine actually gets their vaccines for COVID-19.
Thank you very much.
Parties anyway, so, but there won't be any celebrations even one-on-one. We'll just be working hard.
Yeah, and I wasn't trying to suggest you guys were partying. I just kind of wanted you to put in context that number, but thank you very much.
Very much, and thank you all for joining us. That concludes today's briefing. Our next scheduled briefing is this Monday, April the 26th. Please stay safe.